Yeah. Yeah.
So welcome to the FIC National Meeting, the first one of 2022. So welcome all for being here. I know we have a few new faces today, so I want to give you a warm welcome and thank you so much for joining us. We have a number of things that we want to be able to review today, which includes a new campaign that we're working on, as well as moving into our provincial updates. So I will be sharing my screen here in just a second, so that we can get ourselves started. So the first thing I wanted to go over that we will be going over includes, first of all, our agenda, which I just mentioned, which is our association strategy, some new members, government lobbying, which we always like to start with. And then we're going to be talking about some advocacy efforts that we have going on currently. And then we have our provincial updates. So as a reminder for our association strategy, we have a 5-year goal and a 1-year goal. For our 1-year goal, we wanted to reach 1,000 members for this next year. So for 2022, we would really like to get business association memberships up to 1,000 clubs. And I'm happy to say we are well on the way. So good news here. So thank you everybody for your support and for joining us to bring us up to 644 business associate members. So we are really looking forward to growing our membership base. As you know, we are stronger together. We have a louder voice and we are able to advocate for our fitness businesses that much better. So thank you to all of our new members. We hope you are able to join us not only on the national calls, but please do connect with me so I can also connect you with the leaders of the provincial coalition, so you can also join in on the provincial calls and really be a part of the influence and the change that we hope to administer in this next year. So that being said, I will pass it over to Chris Gray, who will be doing our government lobbying updates.
Thank you, Tricia, and thank you for having me here today, and Happy New Year to everyone. On a personal note, I was just starting to go to the gym with my 14-year-old who was really enjoying it, and hopefully in Ontario we can get back to that sooner than later, and right across the country as well. I will be fairly brief today. I know the agenda is quite packed, and a lot of good stuff going on, and FIC is doing a lot of good stuff in the media and government relations right across the country, so that's fantastic. Obviously, just before Christmas, just before the holiday season, Bill C2, which revised the support programs, the federal support programs, was passed, and we were very pleased to help to change the dial there, where fitness facilities are now included as part of the overall tourism and hospitality recovery program. So hopefully fitness facilities will be able to tap into that and continue to tap into that into the new year. And as I was mentioning to Tricia just before, and the CFIB has a great list of all the support programs that are available, and I'm going to send that to Tricia, who will forward that on to all of the membership so that you know what it could be available to you at the appropriate time. And we are also working on a federal 3 to 6 month GR plan with Sarah and Tricia, and what we'll be doing moving forward, and how we'll be engaging with members of parliament and ministers, and the new sport minister, for instance, as we continue to advocate on your behalf into the new year, and try to make some headway here at the federal level for sure. Sarah's going to talk a little bit about the national campaign here in a few minutes, and our engagement there, which looks fantastic from my standpoint. And the last thing I just want to say is that in the month of January, we will be quite busy on the federal side setting up meetings with members of parliament on the finance committee and trying to engage the finance committee to have us appear in February as part of their 2022 federal budget review process. So that is what is hot on our agenda in the next little while.
Great. Thank you so much, Chris, for sharing. And as we work with Chris with these initiatives and going to meetings with MPs and whatnot, we will keep you all informed with the progress we make there. So next, I will pass it over to our president, Sarah Hodson, who's going to be talking to you a little bit about our new campaign, which falls under our advocacy and protect your reputation piece.
Thank you so much. I also want to just say that I know the term Happy New Year gets thrown around a lot, and many of us don't right now connect to that sentiment. Many of us are struggling, many of us are closed, many of us are frustrated and scared. And I just want to say that we hear you, we are with you. We are all fitness business owners ourselves and going through the same fight and the same battle. And we are doing everything that we can to gain conversations at the provincial and the federal government level. We are advocating for change. We are advocating to, in provinces where fitness is open, being preventative and advocating to keep fitness open. In provinces where there's capacity limitations or complete closures, to advocate to open fitness. We have gained a ton of media attention. I apologize that we haven't been able to keep up with informing you of all of that, but we will do our best to try to post, especially on Instagram, our media pieces. But please know that we are working very, very hard behind the scenes to share the impact that closures and restrictions have on our fitness industry, as well as to ensure that the government understands the benefits of fitness, the benefits of movement, the benefits of exercise. And even as we've seen some recent studies show that in fact, exercise is something that boosts our immune system alongside the vaccine. And so why do we have vaccine clinics open and exercise closed when those two things combined would in fact improve our immunity against COVID-19? So we are with you. We understand that we are in a situation where we are scared for our businesses, for our livelihoods, and that the future access to our members could potentially be extremely limited, if not go away. In response to that, we heard a lot of people starting to share why their gyms were important to them. And we thought, as we were having conversations with government officials, surprised or maybe, not surprised sometimes at the lack of identifying the mental health component and so forth. And we really wanted to ensure that people who maybe don't have access to their fitness facilities now, fear losing their fitness facilities or have limited access to their fitness facilities, could share the importance. And so on New Year's Day, we did launch a social campaign that allows people to simply say who their fitness facility is that they go to. There's two different forms that they can fill out. One is a short form, one is a longer form, and why it's important. The longer form has things like who are your favorite, instructors or coaches, who's your go-to workout buddy, and then you can also tag important government officials locally, provincially, and federally. And we've seen many gyms being identified. Please feel free to share this post with all of your members, as it elevates the profile of your business and the profile of our association. as we are able to get more and more people sharing why you as a fitness facility are important to them. And I will say that, sometimes we can say, oh, well, tagging people, is that really going to make a difference? And we did hear this morning that we do have an invitation from Minister Mary Ng's office to have a conversation with them based on this social campaign. So thank you, everyone. We need to keep going. We need to keep sharing this. We need to share this with our members, and over and over and over again. It is working. But this is also just about having our members have an outlet when they have no control over us being closed, that they have a way to share why you are so important to them. So I will leave it at that. We have developed a beautiful website. Thank you, Tricia, for all of your hard work, literally on New Year's Eve, making and building this beautiful website called Save Fitness Canada. This is really an extension of the very, very successful campaign that went viral in Alberta called Save Fitness Alberta. We have now created our Save Fitness Canada website, and this whole social campaign is based off of that. So thank you. Let's share it. Again, our thoughts are with everybody. We stand with you, and we will keep fighting.
Thanks, Sarah. So if you have yet to follow us on social media, please do make sure that you do so, as well as take a moment to share these posts. We have a couple versions. We have a longer version that you can put in your stories, along with a blank that your members can also participate with, as well as a post that you can do on your actual feed. And it really just gets people to connect with why they need you, why they need their business and your business. Another thing I would like to add is that from the launch of this social media campaign on January 1st, over on Instagram, we've actually had 802% increase in traffic, which is a big deal for us. So I want to thank you all for being a part of that. And we can only see it grow even further than that, because if in the six days we can make such a big impact, there is such an opportunity for us to make an even bigger impact. So any participation and support that you can help with, as well as spread to others, share it, and join the cause, which I know all of you are a part of anyway. So thank you all, and we will keep you updated on this campaign and hope to share more details and more positivity that may come out of it. So that will wrap up our first part of our piece today, and we will be moving on to our provincial updates. So here we have our provincial leaders from each province giving us an update of what is happening where. So we will start today with BC.
Thank you kindly, Tricia. Thanks for having me report on British Columbia. First of all, the FIC, our thoughts go out to businesses currently closed and affected by this new variant, and as well as fitness professionals across the country who are currently temporarily laid off. We're doing our darndest to get fitness open in BC and across the country, and so our thoughts are with all of you on a daily basis. We hope to get you back into your facilities and inspiring our communities to live their best lives very soon. I'm going to be looking this way because I have a magic board here with thousands of notes of conversations with governments and in public health here, and I'm going to do my best to try to work through this as clearly as possible here. And so the data on cases right now on a daily basis in BC are unattainable just because of how transmittable this variant is. Our hospitalizations are seeing a slight increase on a daily basis. Our deaths are actually decreasing on a daily basis here in British Columbia. Currently in British Columbia, gyms and nightclubs are closed. There are some minor restrictions around restaurants and pubs and some other venues in British Columbia. Gyms were closed in British Columbia with 24 hours notice, no engagement from the government or public health with the FIC, which is extremely rare in British Columbia, fairly disappointing as well. The lack of engagement in British Columbia has only caused, with the FIC, has only caused confusion as to what the order means, how people should be reading the order and the intent of the order. And so there's some friction in British Columbia currently right now that we're trying to clarify. Our goal is not to shut down any fitness business in British Columbia. Our goal is to clarify how we can keep fitness businesses open. And so that's what we've been working on over the last couple of days. We had a meeting with Dr. Henry a couple of days after gyms were shut down in British Columbia. We agreed to disagree on the closures of fitness facilities. We shared data, we shared the impact on mental and physical health. We shared stories, touching stories from fitness professionals and fitness owners across British Columbia, and the impact not only that these closures have on them financially, them personally, as well as some member stories with Dr. Henry. She was empathetic, she listened, but we continue to ask for data so that we have more clarity as to how how gyms have impacted COVID. And there's an extremely important point there that we're trying to get across to Dr. Henry and politicians and public health in BC, that gyms do not transmit COVID. People transmit COVID. And so a lot of the times when the government or Dr. Henry are in press conferences, you'll hear them say things like gyms are, well, the new phrase in BC, unfortunately, is gyms are amplifiers of COVID. Gyms, it's just like the American slogan, guns don't kill people, people kill people. People transmit COVID, and they transmit COVID in all spaces, not just gyms, but in restaurants. And so we're working on the communication with Dr. Henry and the government to ensure that there's positive messaging around gyms so that when we do reopen, that we come out of this as a place that people should be running to get healthy, as opposed to staying away from, because COVID will likely be present for quite some time, if not forever. We've seen some positive messaging from Dr. Henry in the press over the last week, but unfortunately, recently she was pressed on data and delivering answers on data from the media in a press conference, and again, called us amplifiers. We immediately emailed Dr. Henry and her team sharing that calling us amplifiers was unacceptable and was irresponsible, in fact. We have kept in touch with Dr. Henry and her team as data on hospitalizations, in particular on data as it comes to hospitalizations, because their share with us was that the opening of fitness would rely highly on hospitalization rates. They're optimistic, they say, that hospitalizations aren't increasing too much in British Columbia right now, and they're optimistic on a January 18th open date. I want to be clear that we don't find the January 18th open date as acceptable, and we continue to press to open on a daily basis tomorrow. So Sarah and I wake up, and the rest of our group, provincial leads in BC, we wake up every day saying we are going to open up tomorrow, and that's what we're pressing on a daily basis. So we're working towards a 50% capacity reopening tomorrow, with some leniency on restrictions in terms of capacity come January 18th. Business BC, so in British Columbia, Dr. Henry has emphasized her reluctancy, hopefully that's a word, American University, I went to American University, so reluctancy to close any businesses further. So she's put COVID-19 safety plans back in place. Right now we are working with public health, not Dr. Henry's department, but the public health side that creates these restrictions for gyms so that we can reopen at least by January 18th with as minimal impact to operations as possible. So alleviating booking systems, masks while working out, and seeing how flexible we can be when we reopen. In terms of the government, Sarah and I met with the Minister of Finance yesterday. Again, we data shared. We shared the importance of opening fitness facilities. I did a data share on fixed costs for fitness facilities in British Columbia for gyms with the government the week prior. So this is a follow-up to that data share. We agreed to disagree on quite a bit. What we did agree on is that they are going to work quickly and swiftly to put a pause on the The BDC recovery loan. So anyone with a BDC recovery loan, we know that we are being asked to pay that back on a monthly basis. We've requested that they quickly put a stop on the ask to repay this loan while we're closed. We've asked them to swiftly connect with BC Hydro and Fortis and utility support so we can have our payments deferred. We've asked for clarity on the orders so that fitness facilities understand whether they should be open or not, as well as we had a strong discussion around enforcement of gyms that clearly should not be open, but are blatantly flaunting against the order. And so we've seen recently in the last 24 hours that fines are starting to be become issued to gyms that are currently open against the order. Yeah, and on a daily basis, Sarah and I are connecting with either on the phone, and if we don't get a politician or a certain public health official on the phone or in a Zoom call in a day, that same day we will send them an email. And our goal on a daily basis is that no politician, this is Sarah and myself and the provincial leads mandate, is that no politician or public health official lays their head on their pillow and falls asleep at night without at least the thought that they have kept gyms closed. And so that's our goal, and I think we're accomplishing that in British Columbia. Thank you for listening.
Great. Thank you, Carl, for that wonderful update as usual. Sarah, yes.
Can I just add that we are in British Columbia starting bi-weekly calls. An email will be going out today to all of our BC members. We're going to be hosting calls every Tuesday and Thursday at 10:30 local time. The first part of the call will be open to all BC fitness businesses, whether they're FIC members or not, simply for our advocacy update. The last portion of the call will be for FIC members only, for open discussion, collaboration, and support. And so please make sure that you are at those meetings, but also we have some social media posts up right now, and please make sure that we invite every business in BC. There's a lot of businesses who are struggling on their own and trying to figure things out. So those calls, again, start on Tuesday. Feel free to share our posts on Instagram and Facebook about that meeting so that we can support as many businesses as possible to understand what is going on. Thank you.
Great. Thanks, Sarah. Let's go to Alberta. Scott.
Great, thank you. So we're open in Alberta. What we thought we needed to do is just be proactive in our communication with the government. So FIC, along with the Dance Safe Alberta, commissioned a letter to Minister Schweitzer, to the Minister of Health as well, and just outlined that we do have about a dozen different playbooks that we've run over the last 2 years, and following the provinces that have closed would be extreme, considering we have other ways to operate the business. It seems the climate in Alberta, the government has internally stated they don't want to close businesses. They don't want to penalize the people that have gotten vaccinated, that are running the the restriction exemption program, REP. So they're really hesitant to make those changes. Schools are open on Monday. However, the opposition in the government is really pushing hard for a circuit breaker for closures. So we're going to continue being proactive with our communication with government. I think we are open because of this communication. To be honest, it would be easy for government just to say, oh well, Ontario and Quebec and BC have already closed, let's close fitness here as well. But I do think we've gotten ahead of the curve. So that's been positive. How long that lasts, I don't know. But we will continue to keep regular engagement with them. And I just want to thank the folks at Dance Safe Alberta for all their help. They're on the call today. So that partnership seems to be working out well. And we're at the same time, we're commencing our outreach strategy. We're knocking on doors to get more facilities to support FIC. We had well over 130 people on our calls when we were in crisis mode. 35 of those facilities were contributing. So we need to get the other 100 or so contributing to FIC. So that's our objective here moving forward. So, so different climate here in Alberta. You know, my heart breaks for all the fitness pros across the country that are not working. It's just a terrible situation. You know, there was a, you know, we really need to, and I don't know if Chris is still on the call, but just, you know, in terms of pressing the feds for, you know, enhanced support for operators. If you're at 39% average losses, you don't get any support. You know, so it's just challenging. People are in debt up their eyeballs. They're getting called now on their personal guarantees for leases, and you know, they are out of rope. And we're seeing some closures in Alberta, and we're going to see a lot more if there's any sort of you know, impact to the sector. But I know it's all provinces, so I don't want to sit here and have the sob story, but it is just the reality of the situation. So we're not going to stop being proactive with our communication. That's the bottom line. That's it. It's minus 35 here. It's going to warm up this weekend, thank God.
Thank goodness.
Scott, I did, sorry, it's Emily here. I did do 2 interviews this week too. I did, well, the same one you did, I think, with CBC, and then I went with Global, and I straight up said, I'm like, that to shut down fitness would be absolutely the detriment of Albertans, and completely against everything we know about health, and that we do have healthcare providers, you know, who are coming to us for stress release, and teachers and parents, and that's such an important part of the journey. Not saying that accomplished anything, but hey, one more voice in the mix.
Mm-hmm.
Absolutely. And thank you, Emily, for always being a strong voice in the media for us. Manitoba.
Hello.
Hi, Stephanie.
Hi. Okay, so in Manitoba today, we were expecting a press conference. I have been refreshing all day, waiting for this press conference to happen. And it has not been announced yet today. So I assume, being that it's 1 o'clock here, that it will not happen today. We have been in constant communication with the Minister of Economic Development here in Manitoba, and things seem to be going well as far as our communication. What has happened here is that the group, there used to be this kind of large sectoral group, like 40 plus members, that was kind of being called into meetings on a regular basis. It's now down to kind of 5 of us that are being kind of impacted on a regular basis. So we are pretty much down to 50% capacity. We are not sure exactly what to expect with the press conference that's coming, but our current public health orders do expire on Tuesday. So there will have to be an announcement before Tuesday as to what's kind of going on there. One of the things that we're a little bit worried about here is that we have had the ear of the economic development officer, or economic development minister. There is rumblings that there might be a cabinet shuffle, which would be really detrimental, because we kind of have the current minister up to speed, have his ear, have his cell phone number, and I feel like that would be a huge detriment if that were to happen. We did have a huge marketing campaign that was set to go for kind of the end of December, and we pulled it just short term, just because the whole intent of the program, it says basically get back to what works, get back to the gym. And unfortunately, with consumer confidence right now, and we thought the gyms were going to be closed by this time already, it didn't make sense to spend all of our marketing dollars for the entire year marketing to people who actually couldn't go to the gym. So we have that currently on hold, but we anticipate that as soon as we feel like things are turning around here, that we will be in full force, and we have a huge marketing campaign ready to go. So that's exciting, but not there yet. We also have some very small sectoral funding that was announced when we went down to 50%. And the intake for that actually opened, it was supposed to open weeks ago, and it actually is opening today. So I did send it out an email to all FIC members here in Manitoba, just basically with that link saying this opened today. A couple people have already gone on and said it's not working yet. But I really wanted gyms to be able to get in there kind of first and get to the money first if there is in fact a pot that will run out quickly. So if you're from Manitoba and you haven't seen that email, send me a quick email and I can make sure that I get that out to you. And that's pretty much where we're at. So we've got some good momentum going. However, just like everywhere else, we're really struggling. 50% capacity. Even though most of gyms are not at 50% capacity, it's all about that consumer confidence and getting people back to the gym and making them feel like it's okay to come back. I talked to maybe Amber, do you want to take 2 seconds and jump in here?
Oh, looks like you're just on mute there.
Sorry, guys. I was connected through my phone on the computer. The computer shut down right in the middle of, right before you started talking, Stephanie. So I'm not quite, I caught kind of mid as I'm trying to switch back and forth from technology. Okay. What did you want me to cut in with?
I was just kind of talking about how, we're at 50% capacity, but for gyms, that's just not, it's not where we need to be. We're just still not getting the members coming back, even though we are open.
Yeah, so I had this conversation, Stephanie, I had a conversation this morning, then I had a chamber meeting at 9, and then the chamber president called me and wanted more opinion on the gym side of it, which is a good thing because he does have a say with the Manitoba government, and the fact that one of our chamber presidents is asking to push a little bit further for the gym industry is a good thing. And they are completely, the chamber is completely on board with what we've been saying, where we have done everything asked of us. 50% is already, it is what it is here. Anything else is definitely going to hurt our industry. We've been trying to do, he said this in his letter that actually goes out today to our government, is just, we've done everything here in Manitoba that we can. We're actually, by shutting down gyms, if gyms get shut down again, because I know we're expecting that announcement any time between today and Monday, to do anything like that is more harmful than good. And that's the point that the chamber wants to get across as well. And I'm glad that they're finally pushing on behalf of us, because even with that funding that they talked about, the funding is based on, so the grant that they have in Manitoba is based on the number of staff you have. So it has nothing to do with your business size, the size of your gym. It has to do with your staff, and they know full well that we're all running skeleton crews right now. We're all working full-time cleaning our own toilets in our gyms because we can't afford it. Same with restaurants, they're down to half their staff, which then minimizes your grant down to about $3,000. So it's not enough to pay even your hydro around here. So something bigger has to be done than that. And at least the chamber is backing us up on that finally too. And it's not just about restaurants, it's about gyms too. So I guess we'll see what happens in the next few days, but hopefully it's not terrible news, I'm assuming.
Yeah, great. Thank you, Amber, for that update as well. Always good to see that fitness is being included. Let's go on to Ontario.
Hi, Trisha. Hi, team.
Hi, Ian.
How's everyone doing?
Good.
Good. Okay, so update Ontario-wise. We were announced to close again on January 5th. It is set to last until the 26th. I don't like the kind of sentiment of that. I mean, it's good that they actually gave an end date. That seems to be a rarity in Ontario. Still hearing like mixed messages whether we think that's going to be extended further or if it actually will stick to the 26th. The main rebates they came out right away with was electricity property rebates. Today, though, actually like 2 hours ago, there was an announcement that there will be an additional grant. It's going to be linked to the one that was in Ontario before, which was up to $20,000. It's going to be a $10,000 amount this time in Ontario, which, I mean, it's good. Anything helps. If it is the 3-week period, I think that would be a decent amount. And anyone who's applied and has received this in the past, the good news is they don't have to reapply. They don't have to actually take any action on it. They'll be automatically pre-screened and then given those funds. It would just be new businesses that would have to basically apply and go for it, which the application is supposed to open very shortly. The sentiment here is definitely very bad. Like, I've even seen some reaction with this funds today, the 10,000, and spoke with a few other owners, and it's not even making an impact on them because they're just so far in the hole at this point. That's kind of where we're at. We had a leadership call between us yesterday just to strategize on next steps. And then Perry has reached out, I believe it's Jerry from CFIB, and he has a call with him and myself on Monday. Perry, I don't know if you're on and wanted to chat quickly on that.
Sure. Unfortunately, with everyone else, and has success, at least communicating with the government, maybe not results-wise, but at least communicating. We've had that. It's our biggest challenge here. So going through this next step, where we actually had grassroots helping us last time, and they were a tremendous asset and really, helped Nick and the team with Movati and Good Life and Orange Theory get through. So the funding is not there right now to bring on a grassroots. So our approach now is piggyback on work with the CFIB and have a common message with them and push from our end through what they recommend. One good thing about the partnership with CFIB, they always, now I've noticed since our relationship, the partnership with them has come on board, gyms are always in their headlines and they're pushing for small business, which is a positive thing. So our plan is to meet with Ryan Mallow, who's the head of Ontario, on Monday. And then he's gonna have a meeting with our team here, like our leadership team in Ontario, to strategize the best way to push back to the government here to try to get some support for the fitness industry, fight for us to open again. And also, it's a good news about those subsidies today, but hopefully we'll get a little bit more. But from the CFIB, it'd be a very, I think, a good partnership, and that's what we're going to put our hat on right now to move forward in a short-term basis, because right now there's some immediate issues with the entire fitness industry in Ontario. That's all I have from CFIB.
Cool. Thanks, Perry.
Great. Thanks, Perry and Ian. And that's a good reminder to all the provinces that FIC is partners with CFIB. So please do make sure that we are using that partnership to our benefit. And if you are a member of FIC, you do get a CFIB membership along with your FIC membership as well. Let's go on to Quebec.
Hello, everybody. Hope all is well for you. Bonne année à tous et à toutes. Happy New Year. So here in Quebec, everything for the gym was closed at the 4-hour delay. So it was around, I think it was December 20th at 1 o'clock in the afternoon. The Prime Minister announced that the gyms had to close at 5 at night. So from 3 to 5, we had a big rush here. There was a lot of people in the gyms, and everybody wanted to pump the chest a little bit just before Christmas. And then we had to close at 5, and nothing was really announced for any help. Obviously, we had some money coming in because like the 21st day of the month, we were open. So it's kind of difficult right now just to understand, are we going to be able to have some money for the 10 last days of December or not? We are asking at this point some news. So around that, after that day, the sport was still open in Quebec, but just the gyms were closed, and you were able to go for 25 people doing classes. So the boxing studio were still okay to operate, the climbing places too. So it was kind of weird. We were asking the government, like, good job, you keep the sport open. It's important for mental and physical health, but why are the gym closed if you're allowing people to go 25% in the boxing studio, but not in the gym? Since that date, so we sent a letter to the sport and to the public health just to understand, and try to see if we could jump in also and be able to have people in our gyms. But around December 30, they close everything. So all the sport, kids cannot play sport anymore. Everything is closed, but not the malls, like the first line here. So the malls are still good to go. To that date, you can go shop in the mall because everybody know COVID. Don't go to mall. You don't like to shop, so that's it. And since that, we sent 2 other letters at the beginning of January. So one to the work minister here, just to say we need some help. We have a lot of professional quitting the industry, and we need so we had 3 like ask for that minister, and then the economy also. And we, like you were talking about CFIB, we always send all the emails when we send something to the minister, like any ministers. The CFIB is in the email. So yesterday I talked with CFIB, and they're gonna retake a lot of our ask, and they're gonna bring themselves those asks at many tables, and they are trying to have a meeting with Minister Fitzgibbon at the economy here, so we could be at the table too with CFIB for that meeting. So I'm waiting for news. The strategy here in Quebec is first of all, we're gonna go for all the letters are sent to the party that is ruling Quebec. So it's la CAQ, so Coalition Avenir Québec. But at the end of this week, or we are Friday, but I think it's going to be at the beginning of next week, I'm going to send all the ask we made to all the people at the Assemblée Nationale. So all the party will be able to know what the ask we are doing are. And at the same time, we're going to send all those asks and all those letters to the media. So they can pick up some question and just challenge in the weeks to come the government on why aren't you answering FIC in Quebec. And then we're going to have a meeting at the beginning of next week with all the gyms, so members or not in Quebec, because we have a strategy. We really we want to use the beginning of the year. The media are asking us to just to go and say it's tough. January, it's all the new year resolution and what is happening. Second year in a row you're closed and blah blah blah. So there's media attention. So we believe that if all the gym come together and go out with a strong campaign, we can have a good media attention and maybe bring some of our point in front. So we're gonna have a meeting with all the gyms in Quebec. And then, so we have 3 things coming for this. It's we're gonna retake the campaign, national campaign, so the members can say gyms is important to me and all those stuff. We're gonna have a campaign. It's gonna be called Save Your Health, and we're gonna try to have big billboards around key point here in Quebec and Montreal and Trois-Rivières maybe. And another one is going to be like a direction in an hospital, and you can see emergency, you can see cardiac stuff going in the hospital, and all the training and kinesiology and nutrition bringing you out the hospital. So we are going for a campaign on media like Facebook and all those stuff next week. So we're working on that, and maybe we're gonna have some attention in January. That's it.
Great, thank you so much for that update. And now we can actually go into some comments and questions that any of you may have. So we'll do like an open forum. Feel free to raise your hand or speak up. I know we always have some questions going on, and that could be about anything we spoke about, also including the campaign that we have.
Trisha, while we're getting those, I'm just going to remind people in Quebec that the, people francophones across the country that the campaign will be available in French soon. We just had a couple of things to tweak on it. So the national campaign about the short one and the longer version, just the facts, etc., that Sarah showed at the very beginning will be available. I'm putting it out there, Tricia, will be available. She and I are going to have a fun weekend as early as possible at the beginning of next week. And so that's coming out soon, guys.
Yeah, wonderful. It's on the way. It's being made. We'll go to CEO.
Hey everybody, how you doing?
All right.
I'm calling from well, I'm on the Zoom meeting from Quebec, and I noticed that there was some statistics that were passed around. And when I spoke to some people in the industry, nobody was really able to really give me a proper answer. A while back, you guys done a survey and you had published something that says that 42% of health clubs have closed their doors. Now, when I look around my neighborhood and I look, I don't see that. I don't see those closings, and I'm just wondering, how did you guys derive to those numbers?
I can speak to that unless anybody wants to jump in, but so thank you. That is an URSA stat that we were able to use. We don't have, we kind of were extrapolating that to Canada, in that we were being continually asked, what is the impact on fitness businesses? And it was the closest number that we had. We hope, and we actually just had a meeting on, thank you for asking this question. We just had a meeting yesterday on this, and how were we able to gauge both provincially and nationally on the impact of closures. Are we able to look at business registrations in talking to the province in British Columbia? Of course, provincial business registrations, even though a business may be closed, that doesn't mean that the business registration number goes away that day. It can even take years of someone in insolvency to go through all of the processes for that business number to go away. So that may not be an accurate way for us to fully gauge this. And unfortunately, for the fitness businesses that have closed, they are not going to be engaging with us on these calls, other than brands who have had locations specifically close, which includes my brand. So I would be able to say a few locations that have closed, but we need to figure out a way to get the exact right data. But that was just an extrapolation from URSA. I remember back in the Save Fitness Alberta, there was a graveyard, and it was a very, very big graveyard. And you guys maybe had actually gotten some data. Emily, do you remember if you had any data on closures at that point, or if you had an understanding?
That was just me pulling the names of the studios I knew that had closed.
Yeah, okay.
I also got a lot of flack on using the word graveyard, just in case anybody else decides to do that again.
Yeah.
You know, there's actual people dying. I'm like, well, guess what? To business owners, businesses are the people.
Yeah. So we will continue to work on that and
so the data that was issued by FIC, from what you were telling me, is a US data. It's not Canadian data then.
So yeah, it's an extrapolation of the URSA data. We also did a survey of Canadians, and we did receive other data, but not necessarily from the industry. Another thing that we're wanting to do is CFIB may be our best way to, in fact, get this right amount of information. So we're going to continue to drill in and try to get actual Canadian data.
That's the other thing I was going to say, is that if we could get real Canadian data, and it's going to guide us, because I remember when this data came out, suppliers were calling me and they were freaking out, and I'm like, I don't know, maybe it says 42%, but when I look around and I count 20 gyms, there's maybe one that closes, there's 19 are open. So that'd be interesting to analyze.
Yeah, absolutely. Thank you for bringing that up. And we are working to improve that and to gather the data. It's one of our strategic opportunities this year, is to have correct and timely data within the fitness industry. And I know that we're supported by Mo and CanFit Pro in their initiatives to do that also within fitness professionals. So 2022 is the year of accurate Canadian data.
And we'll also be putting out a survey in the next couple of weeks as well to our members to assess the situation. So we will have something for you very shortly.
Hey,
Thank you for the question.
Just to add one thing there, I mean, contextually, like looking at neighborhoods, it can look very different. Like that's going to probably be very different across the country. For example, my studio's in downtown Toronto, and I can walk to 4 studios that have closed, like within a few blocks away. So just the example, like if you see in your neighborhood there's 21, like I can physically walk 5 minutes to 4 studios that have closed. So I think it just will be different. It'd be great to get a solid data point number, but for each of us visually in neighborhoods to see that impact, I think it'll be different from your downtown areas where rent might be skyrocketing and it sinks someone really fast versus some suburban areas. Just to add that in.
Great. Thank you, Ian. Let's go to Evelyn. Oh, Evelyn, you're just
hello.
There
Sorry. Okay, good. Hello, everyone. An idea that I want to share with you, just to have media attention and to be able to share a positive message. I wrote for the paper a letter about the fitness trends, and because it's the beginning of the year, so and I got right away interview that were proposed to me to the TV and now to the radio, and even really funny to Saskatchewan Radio Canada. They asked me for an interview for French people, so I'm gonna have to speak with Scott. But this being said, this paper about fitness trends, I use it to speak about the industry, not just to speak about the fitness trend, but to speak about what the industry does in right now. And it's just an initiative that I think that right now it's very, very positive. And I got numerous comments from people saying, "Oh my God, you gave me the energy to start something, even if the gym are closed." So it's not because gym are closed that training is closed. And that was really the message. So I just encourage you to try to find sometime another way. It's the beginning of the year, and we have a lot of things to say about how we can help people to exercise. So my experience shows that it's very positive. So just to share that with you guys.
Thank you, Evelyn. I'm gonna ask Mo, can you please have somebody send both the English and French trends reports over to Trisha so Trisha can send them over, because Canfor Pro surveys all of their members and it has some really great graphics and as one of our partners and everything else, and it's available in 2 languages, both official languages. And so Trisha can probably send that over with everything today. And it'd be a great way to, like, thanks, Mo. It'd be a great way for us to bounce off of something like that. That's a fantastic point. Thanks, Evelyn.
Yeah, wonderful. And happy to send that to everybody. So I will connect with you, Mo, on that. And Emily, I see you have a question or comment.
Yeah, actually, questions kind of come back to data that exists. Has anybody yet compiled? I'm sure there's got to be new research. I'm sure we all saw the one this week about, obesity, people and weight loss and effects from long COVID. And I know there's like a lot of, mixed opinions on that specific article and like how we want to use it most effectively in our industry. But I'm sure that 2 years into this, there's more research, whether from the States or Europe or wherever else, even around fitness, mental health, connections, and really talking a little bit more about like how we're a solution to help get our provinces and country out of this. The reason I ask is that, I feel like we've fought a lot on this many studios have closed and this many studio businesses are gone. And this is the effect of debt. And I don't feel like we've gotten a lot there. And I even feel like the public's personally kind of tired of hearing about it because everybody's exhausted and everybody's burnt out and everybody's had their negative effects. And I just wonder if it's time, even in some of our kind of comeback campaigns, to start talking about the positive effects and how we can help get out of this, and why fitness is important. And even if there's opportunity to use some of that data in our communications with government leaders and decision makers, and flipping the narrative to a little bit more, okay, you can look good by starting to give your constituents some power, some tools, and stop lumping us into the same category as nightclubs, because we're not, and I know, I think Natalie, I think it was you who shared, okay, we don't have to attack other industries, and that's fine. I respect that. But the reality is that I think that we would all agree, and most people would agree, that there are benefits to accessing gyms and fitness facilities that cannot necessarily be shared in the same way by nightclubs, and why we shouldn't necessarily always be lumped in just because we're in an enclosed space where people exhale. So I saw something hop up in the chat. Has anything been compiled at all on this? This is my question.
So we're putting some stuff together. The one I popped into the chat is actually Renaud found that one, which was how being physically active, I want to say 3 times a week, gives your immunity a 50% boost on top of the vaccine.
Cool.
And so some of those things are starting to come out now. One of the things we talked about on our last leadership call was how to boost. So there's the booster, and then there's everything else you can do to boost it. And so let's focus on an and type of campaign so that we never get lumped into the or. So it's sure the vaccines and the booster and talking about other things. Our Quebec campaign is a little bit like that too, talking about how exercise. And so we're moving towards it, and we're starting to do some of that. And I think it's really important for us to keep sharing anything that we find so we can keep supporting the data towards that, and really focusing. And yes, the thing to my post yesterday is just really focusing on the positive things that we do. So yes, get boosted and exercise and eat well and take care of all these other things, because clearly 22 months in, our government's not going to do it ever. And so it's really important to focus on how we're part of the solution in healthcare. But I like the idea, Emily, of us starting to gather a lot of those things so that we've got all of those studies, like grab onto the stats. So that's a good idea that we can certainly look into. Sarah, what do you think?
Totally agree.
Yeah, and just to build off of that, Natalie, I was thinking of, at the beginning, and we are still open for the moment in Alberta, and it feels like we're always waiting for the other shoe to drop. And I'm kind of like, okay, what can we send? What message could possibly get through to our thought leaders that might stop them from making a decision to shut us down? And I know in our province, like Kenny and Schweitzer and all those guys are currently, all they want to share is good news. They want to share that people are moving to Alberta, that joblessness is going down, that, that the economy is coming back. All they want right now is to try to share the good news. And I get it. If I was them, I would want to too. And where I'm trying to go is I'm like, can we give them a good news story? Like, can we give them like good news? Like by simply going to the gym, by doing this, which are still open in Alberta, you can, fight the effects and stuff like that. And sharing those messages. And I think the more of those powerful peer-reviewed studies that we can show, I think the more we can kind of like bolster a message that turns into campaigns, whether provincial or national, and hopefully messaging into our thought leaders. So I wonder if we can just select, like Trisha, if any of us on this call right now come across like any kind of resources, would you be willing to just compile them if we find any great ones?
Yeah, absolutely. Send them my way, and we can make sure we start building a database of that. Yeah,
that'd be awesome. And thanks for Eric. Oh, thanks, Eric. And yeah, no, that's awesome. And I'm gonna maybe start working on some campaign stuff around this too. So if I kind of come up with anything or create anything, I'll make sure to share it out too, if we get anywhere with that.
Wonderful. Thank you, Emily. And Erin, we will wrap up our conversation with you.
No, I was just gonna say, Emily, the link I just popped into the chat is research from the British Medical Journal that a lot of people have been quoting, but you might want to just copy that link. That is the one from Kaiser Permanente last year that proved that physical inactivity was directly tied to a more severe outcome with COVID-19.
Yeah.
And it was a 48,000 person study, but that was from the British Medical Journal. You might just want to copy that, because that is, being armed with that kind of evidence is one of the strongest things that we've got.
Totally. Thank you, Erin.
Wonderful. Thank you, everybody, for sharing today. And hopefully we have better and brighter days coming this year. So on that note, we will wrap up our conversation, and we will see you all again very, very soon. Thanks, everyone.